Picture yourself standing on the churned mud of Agincourt, the air thick with the metallic tang of blood and the acrid smoke of burning pitch. The screams of the wounded rise above the clash of steel, and somewhere in that chaos a figure moves with desperate purpose through the carnage. This is the medieval battlefield surgeon, a practitioner working at the razor's edge between life and death, armed not with modern medicine, but with inherited wisdom, improvised tools, and a grim determination to save lives against impossible odds. What these men knew about survival and healing, gleaned from centuries of warfare and experimentation, would shock modern practitioners with both its brutality and its surprising effectiveness. This is the story of how they kept soldiers alive when death seemed certain. The healer's arsenal. When honey became medicine, the medieval surgeon approached a wounded knight with tools that would horrify us today, yet hidden within his methods was genuine medical insight. When John Bradmore, surgeon to Henry IV, treated the young Prince Henry after an arrow pierced his face at Shrewsbury, he turned to a substance every soldier carried in his pack: honey. The golden syrup, applied liberally to the wound channel, kept infection at bay in ways the surgeon couldn't fully understand. He knew only that wounds dressed with honey refused to fester, that the angry red lines of blood poisoning failed to spread when honey sealed the flesh. We now know that honey releases hydrogen peroxide as it breaks down, creating an environment where bacteria cannot thrive. Medieval surgeons discovered this through countless observations on countless battlefields, watching which men lived and which men died, refining their craft one wound at a time. Wine, too, became a weapon against death. Surgeons washed wounds with heated wine or sharp vinegar, the alcohol and acetic acid burning away contamination, even as the patient screamed against the pain. They mixed egg whites with rose oil and wine to create protective dressings that shielded exposed flesh from the filth of the battlefield. These weren't superstitious rituals, but empirical treatments born from watching infection kill far more men than swords ever could. The maggot's gift, nature's scalpel in the wound. When gangrene set in and flesh began to rot, surgeons sometimes turned to an ally that seemed to crawl from nightmare itself. Blowflies, drawn to the smell of decay, would lay their eggs in necrotic tissue, and the resulting maggots would feast on dead flesh while leaving healthy tissue untouched. Sharp-eyed surgeons noticed that soldiers whose wounds harbored maggots often survived when others perished, their wounds cleaned by nature's own scavengers. The practice required careful observation. Only certain fly species produced larvae that healed rather than harmed. This was fieldcraft at its most fundamental, reading the signs of nature and turning even putrefaction into possibility. The maggots secreted antimicrobial compounds as they fed, fighting infection on a microscopic battlefield the surgeon couldn't see but could observe through its effects. Innovation born from desperation, that's the story of Paret's discovery. At the Battle of Turin in 1537, French military surgeon Ambroise Paré faced a crisis that would well change surgical history forever. The traditional treatment for gunshot wounds demanded boiling oil poured into the injury to cauterize and cleanse, but Paret's supply had unfortunately run dry. Desperate, he mixed egg yolk with rose oil and turpentine, creating a balm he applied with trembling hands, certain he'd condemned his patients to death. Yet, when dawn broke, those treated with his improvised mixture rested easier, their wounds showing less inflammation and angry heat than those who'd received the standard burning oil. Paret had stumbled upon a truth that contradicted centuries of medical doctrine. Gentler treatment produced better outcomes. His willingness to observe, rather than simply follow tradition, marked him as a true survivor, someone who adapted when the old ways failed. The final lesson here is ancient wisdom for modern preparedness. These medieval surgeons understood something fundamental about survival that, honestly, still resonates across centuries. They worked without the luxury of certainty, forced to innovate under pressure and learn from every tragedy. Their honey and wine washes, their careful observations of which treatments worked and which killed, well, these represent a mindset essential to Fieldcraft, the willingness to question, to observe, to adapt. In our modern world of preparedness and self-reliance, their legacy reminds us that survival knowledge is built through experimentation and hard-won experience. Subscribe to Fieldcraft Chronicles and share this video with anyone who understands that history's toughest lessons teach tomorrow's most valuable skills.